So, Module 2 is when we're going to now talk about the various sexual dysfunction disorders. And there are quite a few of them, and you've probably heard of them because of the various advertisements and other things that tend to go along with this. So, we're going to go ahead and first talk about what is sexual dysfunction. What sexual dysfunction is, it's going to involve disruption of any stage of sexual response cycle that we talked about in Module 1. It's going to inhibit sexual desire and interfere with physiological responses that lead to orgasm. Now, it's important to note that when we talk about sexual dysfunction, it is not just a singular problem typically. Most sexual problems are defined in terms of a couple rather than each partner individually. And the problems in sexual behavior usually involve these kind of basic physiological responses or behavioral skills, along with each person's thoughts about meanings of sexual behavior. So both physiological and mental coming together to have an influence on overall sexual performance. So you can see this is just an overview of some of the sexual dysfunctions that we'll be talking about in the rest of this module here. You can see that they can be a lifelong problem, or it can be acquired and interrupt their normal sexual patterns. May be generalized and happen in every encounter that they have, or maybe just situational. And all of it depends in these different areas here. You have sexual desire disorders, sexual arousal, orgasm, and sexual pain. We'll go into more detail here in a minute. So the first of the sexual function disorders is hypoactive sexual desire disorder. So when we talk about sexual desire, that's going to set the stage for sexual arousal and orgasm that we talked about in the sexual response cycle. And the person's willingness to approach or engage in those experiences that will lead to sexual arousal is also part of this whole sexual desire. So hypoactive is really defined in terms of subjective experiences. When we define it, it's really due to things like a lack of sexual fantasies, lack of sexual experiences. But the central interest is really the issue of interest in having sex rather than participation in it. There are a lot of people that have hypoactive sexual desire disorders often experience other mental and medical disorders that co-occur with this particular issue. Here's a model of just functional versus dysfunctional sexual arousal. And you can see there are a lot of parts here that go ahead and contribute to dysfunctional performance. It could be negative affect. If you don't have a good opinion of having sex, then it's obvious that that would be something that you'd be reluctant to engage in. Maybe thinking about what are some of the public consequences of not performing. So then you have maybe anxiety develop. You still have the increased autonomic arousal, but you're increasingly efficient. The tension is really focusing on the consequences of not performing versus on the more erotic cues that you can see in functional performance. And then finally, what ends up with all of these kind of negative feedback loops is the dysfunctionality. This is just one model of things that might happen. Another issue that we see, and there's a lot of advertisements for, are erectile disorders. This is erectile disorder is obtaining an erection that's sufficient to accomplish intercourse or maintain erection long enough to satisfy the self or partners during intercourse. It can be relatively transient, which means it can happen every once in a while, or it can be chronic where it's happening frequently. Another type of disorder is female sexual interest or arousal disorder. As you can see here, there is some impaired sexual arousal in women that are more difficult to describe than what we see with erectile disorder. Erectile disorder, it's fairly easy to see what's happening. Not so much with female sexual interest arousal disorder. One of the things you do see, though, is an inhibited sexual arousal. So the woman cannot either achieve or maintain the genital responses. In this case, for women, it would be lubrication and swelling that's necessary to complete sexual intercourse. So when that happens, that would be when we would identify this particular disorder. As far as erectile dysfunction, what you can see here is typically the older you get, the more likely you will have moderate to complete erectile dysfunction. So starting in the 40s, it's very rare to have complete or moderate erectile dysfunction. As you see, as the decades go by the age of 70, you see a much higher percentage of men who have that particular issue. Now, the other issue that we had just talked about was the female sexual interest and arousal disorder. Now, there are some women that have the arousal, but they do not have orgasm. And so that's what leads to the female orgasmic disorder. And this is where women aren't able to reach orgasm, even though they have the arousal aspect of it. And this can be broken down into two different areas. They could have a generalized orgasmic disorder, and this is where they've never experienced an orgasm by any type of means. Whereas the other type is situational orgasmic disorder. In this case, the difficulties occur when women are able to reach orgasm in some situations, but not in others. Switching back to men, we have the premature or early ejaculation. This is a problem in controlling the ejaculation. They can't prolong the period of sexual excitement long enough to complete intercourse. Once they become intensely aroused, they reach orgasm very quickly. So for men who have this lifetime premature ejaculation, over 90% routinely ejaculate within a minute after they insert their penis. So that's too quick, and then there's too long, which is the delayed ejaculation. And this is either the delay or inability to accomplish ejaculation at that point. And it's defined in terms of sexual behavior with a partner, and it has to be experienced in most sexual encounters and not result of any voluntary efforts by the man to try to delay the orgasm, which is sometimes seen as desirable by some individuals. Another sexual dysfunction for women is genitopelvic pain or penetration disorder. Genitopelvic pain means that there is pain during intercourse, and this particular disorder can develop maybe from that initial issue, and then you have the fear of pain or vaginal penetration because of the pain that's associated with it. Then finally, the tension of the pelvic floor muscles, so that they are very tense, making intercourse difficult. And that's due to a couple of these phenomenon, and I am going to butcher how you pronounce this. Dyspareunia. Dyspareunia? I really need to look up that word. But it is persistent genital pain during or after sexual intercourse. And as you can imagine, it's hard to get aroused for an activity that hurts. As far as vaginismus, this is whenever there is penetration of the vagina, there's an involuntary kind of muscular spasm, and that snaps the vagina tightly shut, which means that you cannot insert any object, whether it's a gynecological exam or it's a penis while having intercourse. As far as the frequency of all of these various disorders, premature ejaculation is probably one of the most frequent forms of male sexual dysfunction. As you can see, 1 out of 3 adult men have that issue, so that's roughly a third. Not all the time, but it is a frequently occurring issue. All other forms of sexual dysfunction are typically reported more often by women. A third have talked about a lack of interest in sex in one survey, and a quarter experienced a period of several months in which they could not reach orgasm. So that's a very brief overview of the various sexual dysfunction disorders that are in the DSM-5. And next, we're going to talk about some of the influencing factors that go to the sexual dysfunction disorders starting in Module 3.